Mr. Chairman, thank you very much. And this has been a remarkable hearing for me because I can't remember ever being in such agreement with most of my Republican colleagues on their comments. And I do want to thank Congressman Hearn for pointing out that non-ACA costs are rising too. In fact, I think only Congressman Kelly's older than I am on the dais here and can remember how quickly healthcare costs were rising before the Affordable Care Act. I also was in the car business. I go back to when we paid for all the health insurance for our employees and their families, and then we had to exclude their families. Then we had to start charging the employees because they were going up so very quickly. That was the reason we had the Affordable Care Act in the first place. So, Mr. Hemsley, did a little quick research. Switzerland, 12.2% of their GDP on healthcare, with 84 is the life expectancy. Denmark, 10% GDP, life expectancy 83. Italy, 8.4%, life expectancy 84. OECD overall, 9.3%, life expectancy 81. And here's the United States, somewhere between 18.5% and 20%, with a life expectancy of only 78 years old. I love American exceptionalism, but why are we exceptional in this? Why have so many other first world countries figured out how to do this and we have not?
We have a system, representative, and again, excellent point. We have a system that drives volume over value and outcomes, and we have a system that drives very strong pricing. So if you take a look at this issue for probably more than 30 years, academic research and real-world experience suggest it is the prices and the service level, the use levels of healthcare services. And it is what we are focused on all the time to reduce and keep moderating those costs in an environment where volumes are predominant when value should really be the predominant force in evaluation. So we believe that a drive towards a value-based care incentivized system to the value and the health status of an individual will, over years, pull these trends back into a more normal state and head toward the direction that you're seeing. And you can see it when you see the difference in comparable services and comparable product costs when you compare those countries that you suggest to the United States.
Yeah. I know. I had the good fortune to live in Switzerland for 4 years, and the healthcare was excellent. Mr. Markovich, have you seen, California and other places, the impact of private equity on your costs? I noticed there are 10 states now that are trying to regulate private equity in the healthcare space after the bankruptcy of Steward Healthcare and Prospect Medical Services.
We have seen some impact. I don't think we've seen it necessarily as much as perhaps other states have. Mrs. Boudreau was talking about the fact that on the independent dispute resolution, that's probably the place the industry writ large is seeing it the most, where private equity-backed providers are swamping the system with these requests for independent dispute resolution and really using it as a profit engine simply to drive costs up. There has been some acquisitions of providers, but I do think the regulatory environment in California has limited the impact more in that state than I've seen outside the state.
Okay, Ms. Boudreau, Elevance Health, when you were Anthem, settled a claim for denying mental health and substance abuse disorder treatment. Have you updated the medical necessity guidelines to generally accepted standards to avoid this in the future?
Thank you, Congressman. We are very compliant. We settled that. It was an older case and did not have liability, but we decided that it made sense because of the long-standing litigation. But we are absolutely have a strong compliance program around making sure that our mental health parity is followed across all of our plans.
Very good, thank you. Mr. Joyner, I wonder if you want to pile on to Mr. Hemsley's in terms of perhaps your perspective in 30 seconds about why our system is so different, so much less efficient, and with worse outcomes.
Yeah, I think I'm consistent with his views. Today, we have a system that actually rewards those for more volume, and I believe we need to have a strong movement towards getting alignment between the plans and the providers to focus on the outcomes of the patients in which they serve. And until we get there, I think we're going to be challenged with the growth on the utilization and the rates of the services being provided. I also think that technology is going to be a breakthrough. And this is what we haven't talked a lot about in the hearing today, but I think technology has an opportunity to solve for the interoperability challenges that makes healthcare so frustrating for the patients. The systems don't talk to the plans, the patient's stuck in the middle, and I think there's a really strong movement towards having technology solve and actually connect the providers across the system to serve the patients better.
Very great. Thank you very much. I'm going to yield back.